Welcome to the Sunrise Clinical Manager SCM Viewer Training video. To access SCM, you need your former Saskatoon Health Region username and password, and will need to use these 3 times. First, to log on to Health Region computer, second, to log into Citrix, and third, to log into SCM. Once logged into a computer, you can access the Citrix link 2 ways. Find and click on the link on your Health Region computer desktop, which looks something like this with the label Citrix EHS Provincial. If on a Windows 7 device, select the manual logon link instead. Or, if it is not on your desktop, you can find the link on the former Saskatoon Health Region Infinite site by hovering over Resources and clicking on the Citrix EHS Provincial link there. Again, if on a Windows 7 device, select the manual login link instead. The Citrix window will look like this. Click on the Logon button. If on a Windows 7 device, the Citrix window will look like this. For the Citrix username, enter domain SKTNHR / before entering your username like this. Once logged into Citrix for the first time, click on the Apps button at the top of the window. Click on the star to the top left corner of the SCM icon to add it to your favorites for the next time you log in. Single click on the SCM icon and you will get the SCM login screen that looks like this. If prompted, enter your username and password.
To become familiar with SCM, it is recommended to add text labels to all the main toolbar and tab toolbar buttons. To do this, go to Preferences drop-down menu and select Toolbar. In the Customize Toolbar window, go to the main toolbar preferences and select Show Text Labels from the drop-down menu for text options. And do the same for the tab toolbar preferences. In this window, you can also customize which buttons you want available on your main toolbar. You can add buttons by selecting them under the Available Buttons section and clicking the plus button to add them to the selected layout section. You can also remove buttons from your selected layout section by clicking on the button you want to remove and clicking on the minus button. You can move buttons up or down by selecting the up and down arrows to customize how you want your buttons organized. When done customizing your main toolbar, click on the OK button. Now you have the text labels under the buttons on the main and tab toolbars. So you do not have to hover over each button to know what they do. After you have become familiar with the buttons, you can always remove the text labels from the same window you added them. All the main toolbar buttons become active when you select a patient you are to review from the list under the Patient List tab. The Previous and Next Patient buttons allow you to scroll through your patient list even when you are not on the Patient List tab. and therefore preventing you from having to toggle back and forth between the patient list and other tabs to view different patients. You just have to verify that you are on the correct patient by checking the header. When you have been logged in to SCM for some time, it is recommended that you hit the refresh button to make sure your SCM session is up to date. If needed, you can print a list of your patients on demand by clicking the Print Reports button and selecting patient lists from the drop-down menu for report category in the report selection window. You can either select current patient list by location, sort by location, or sort by patient. Then click on the Preview or Print button. The report prints to default desktop printer of the workstation, or it previews on the screen with an option to print if desired. Press OK on Report has been submitted box and then select Close on the report selection window. The Saskatchewan EHR button is just a link to the provincial EHR website if you have an account. Now to learn about each of the tabs. In the Patient List tab, you should have Logon Location as what appears beside Current List. You can customize the columns you can view here by clicking on the Select Visit List column button. In the Patient List column configuration window, you can add columns by selecting them from the Available Columns section and clicking the Add button so that they will appear in the Displayed Columns section. You can also remove columns by selecting the column under Displayed Columns and clicking the Remove button. You can then reorganize the columns by clicking on the Move Up and Down buttons or once you are done here, you can click the OK button and select the column and drag it to where you want to move it. You can resize the width of the columns, and you can sort the columns by ascending or descending order. You can even lock columns, especially if you need to scroll across and you want to know which row belongs to which patient. And do this by right-clicking on the column and then selecting Lock Columns. It is also recommended that you turn on flags for new results and new documents, so that you are notified as soon as they become available. To do this, click on the Select All Patients button and then the Flag New On button. Then click the Yes button when asked, do you want to turn the flag on for all the selected patients. That way, when new results and/or documents become available, you can directly access them from here by clicking on the flags. When you are done reviewing the new results, you can click on the Clear Flag button. And when you're done reviewing new document details, you can click on the Mark as Read and Close button. Now you know that you have already seen them. However, do note that only physicians can clear flags on status board views. There are 3 types of patient lists that you can create. The first one is a criteria-based list, like this logon location one, which is based on a location criteria. And you can create these lists by clicking on the New Visit List button. The criteria you can create your criteria-based lists on are your role, which is the physicians, location, providers, service, visit status, and orders. If you're using location and you select Include Patients at Selected Locations Only, make sure you hover to the right to get the scrolling bar. To add a selected location, select the location, then click the Add button. Once you're done selecting locations, click OK. Here you can name your criteria-based list. And then click on the OK button. The second list is a special list. The third one is a temporary list. With the logon location selected under Current List, you can narrow it down to only the patients you are assigned to care for that day. To do this, you would select your first patient. Then, while holding the Shift key down, select the last patient in the group when selecting multiple patients in a row. Then, hold down the Control key while selecting your other patients if you have to jump past patients in the list that you are not responsible for. After you have selected all your patients, click on the Save Selected Patients button. Select the New List Name option and type your new list name in the free text box beside New List Name. We recommend naming the list as the date of your shift. Then click OK. You will know this is a special list because there is an asterisk beside the list name. The only issue with a special list is that it is not updated by registration when patients are discharged, transferred, or admitted. So you will need to remove patients that you discharge or transfer from and add patients that you admit to your list. To remove a discharged or transferred patient from your list, select the patient, then click on the Remove Selected Visits button. Add a newly admitted patient to your list, click on the Find Patient icon in the main toolbar. In the Find Patient window, enter the search criteria that you have, which we recommend the HSN number by typing in the Quick ID cell H- and the 9-digit number without any spaces. Click the search button to the right and patients matching your search criteria will be listed below. Select the correct patient by verifying their birth date and/or MRN. Then click on the Show Visits button. In the Show Visits window, the patient's visits since 2010, when SCM went live in the former Saskatoon Health Region, will be listed with the most recent visit at the top. Select the correct visit by verifying the visit ID, which is most likely the visit at the top. Then click Save to List to add it to your special list, but to show you the temporary list, click on the OK button. Note here that if the patient has not yet been assigned to your location, the list of visits will be grayed out and an override chart access window will pop up. Select a valid reason from the drop-down, such as clinical care, and you can elaborate on reason for access by typing more information in the Other Reason free text box. Then click the OK button. Override chart access is required for auditing, and if the reason is not valid, you can be contacted and questioned by Privacy and Access. This override will allow you access to the patient chart for a maximum of 14 days, which you should not require once the patient has been assigned to your location. The temporary list cannot be customized and will be removed when you log off. To add the patient from your temporary list to your special list, select the patient and then click on the Save Selected Patients button. Select your special list from the Available Lists section and click the OK button. Make sure you click the New Flag On button to receive notifications for the new results and documents for the newly added patient. When you are done your shifts for the week, you can remove your patient list by using the Delete Current List button. Then just click the OK button in the next window when it reminds you that the current list will be deleted. You can also use the Delete Visit List button to delete multiple patient lists at once. To do this, you would select your first list, then while holding the Shift key down, select the last list in the group when selecting multiple lists in a row. Then hold the Control key while selecting your other lists if you have to jump past lists in the list that you do not want to delete. Click the Delete button and then the OK button when warning pops up that selected patient lists will be deleted. Observe the patient header where you will see the selected patient's name and location, ED weight if it was entered, admission and discharge dates and times if applicable, provider, MRN or patient ID, visit ID, age and birth date, gender, any infection control, such as multi-drug resistant organism, MRSA, VRE, or carbapenemase producing organism. And if the patient has had a lung transplant, you will see the health issue LTP. And if the patient has a bleeding disorder and is part of the Saskatchewan Bleeding Disorders Program, you will see the health issue bleeding disorder. If the patient requested privacy during registration so that their information would especially not appear on any public display boards, they would have confidential person on their patient header. To view the Orders tab, click on it. And similar to other tabs, there is an Options panel where you can filter what you want to view. It is suggested to check the box beside Retain Selections for Next Patient if you are reviewing more than one patient. Get yourself familiar with what you can filter. One filter to point out is Status Priority, where under the Quick Pick, you can filter down to active and pending orders. Just make sure to remove selected filters by selecting No Status Priority Filter when you want to see everything. If at RUH, orders are entered through Order Entry and will display statuses such as pending, collected, or resulted. Otherwise, other areas will have orders appear here after there are results, which are displayed in categories alphabetically. Categories can be collapsed by clicking on the minus beside the category, or expanded by clicking the plus beside the category. In the Results tab, you can filter under the Options panel to what you want to view. There are three types of flags, as seen here. The green flag indicates numeric results within the normal range. The red flag indicates that at least one numeric result falls outside the normal range. The yellow flag indicates that the abnormality for at least one of the results is either unknown or unspecified. There are 4 display views. The summary view, which is the current view. When you double-click on one of the flags, the Report by Order view will appear. The Trend view shows multiple results for specific items. And when selecting an item with multiple results, you can click on the Trend and Graph view. You can switch display views either via the Options panel or the Display View button. To view medical imaging reports, double-click on the flag in the Summary view. Click on the plus icon for the most recent version of the report. Otherwise, if there is an H icon to the left of the plus icon, these would provide historical or previous reports. When you are done reviewing the report, just click the X at the top right corner of the window. To view the image of non-invasive cardiology reports, double-click on the flag in the Summary view and click on the Media Link icon. You can review the report and then click on the red X at the top of the window to return to the previous screen. In the Patient Info tab, disregard alerts, allergies, intolerances, and comments under Summary Views and Data Entry, because we are not currently using these in SCM for your role, and the source of truth for allergies and intolerances remains on the paper allergy intolerance record. Care providers will list all the providers that the patient has seen since 2010 when SCM went live in the former Saskatoon Health Region. You can click on the Show Inactive box if you would like to review the patient's inactive care providers, if there are any. Health issues is where the medical and surgical history of the patient can be found. Most of these are entered by the emergency department nursing staff and physicians, and some are populated by other services for the Infection Prevention and Control Program, Saskatchewan Bleeding Disorders Program, and Saskatchewan Transplant Program. Significant events are any event that may affect your patient's care and will be entered by emergency department staff. For example, no blood pressure left arm, and prescription tampering. Contact information is self-explanatory. Under the Demographics Visit Date section, you can click on the Details button to the right, and then in the Demographics window, you can click on the Other IDs link at the top to view the patient's HSN, and if the patient has a treaty number or RCMP number, those will be found here if provided by the patient. Financial/employer section provides information on the patient's health insurance and employer information if there is any. Visit history will provide the exact same list of the patient's visits that you get when you do patient find, as was demonstrated earlier. The Documents tab includes all documents that would be entered on a patient. Similar to the Results tab, you can filter under the Options panel to what you want to view. Types of documents are documents that have been dictated and transcribed and posted against the procedure date and time, such as operative reports, discharge summaries, consultations, clinic reports, history and physical, post-anesthetic notes, and vascular lab. To open these documents, double-click on a document to review it. To close it, click on the red X in the top right corner. Another document type are those that are created in SCM, such as Emergency Department Clinical Documentation and clinic notes, such as assessments and follow-ups from some outpatient clinics. And these can be viewed just by double-clicking as well on the document. And also can be exited by the clicking on the red X at the top right corner. The third document type are scanned documents. As of June 2017, the Health Record Department at Royal University Hospital is scanning discharged patient records, which means that patient records for RUH patients discharged on or after June 2017 will only be available for viewing in SCM. To open a scanned document, do not click on the line item because you will just get a document indicating that this document has an associated image. Instead, double-click on the media link icon to the left of the document. A new window for the Perceptive application will open. Click on the Fit to Width button at the bottom of the screen to be able to properly review the document. While in Perceptive, you can browse through all of the patient's scanned documents for all visits by clicking on the menu icon at the top right corner. You have the ability to create and save your own filters to categorize and display the scanned documents you would like to view. To do so, click on the gear icon right below the menu button. Name the filter under filter name, such as categories. Select the Show Categories box and the Set as Default box if you want this to be your default filter. Click Save, and then Apply. Do note that only the categories that have documents associated with them will be displayed, and that to always look in the ECM category if it is displayed, because if you can't find the document you're looking for under the correct category, this category contains documents that have not been built in the system yet. Click on the image icon beside each document you want to review, and they will collect in the background. Once you've selected all the documents you want to review, click on the menu icon. To view each document, double-click on the top of the bar of an outline document. Click on the X at the top right corner of the document to exit. Or you can also click on the double arrow icon to review the document. Then the Fit to Width icon at the bottom. For scanned documents with multiple pages, you can see the other pages by clicking on the arrows beside the page numbers. When done reviewing scanned documents, click on the X button in the top right corner of the Perceptive window to return to SCM. The fourth document type are images of documents that are generated upon discharge from the Clinical Information System application IntelliSpace Perinatal. ISP, which is where Maternal and Child Services is documenting obstetrical information. To view these image documents, double-click on the media link icon to the left of the document. Click on the X in the right top corner of the window when you are done. When 100 or more documents are brought into view, you will need to select the next tile panel icon to proceed in viewing the next page of documents. Under the Flowsheets tab, you can find flowsheets that were completed on the patient in the emergency department. Similar to the Documents tab, you can filter under the Options panel to what you want to view. There are currently 4 flow sheets, including ED Assessment and Care, where RNs chart every shift or when there are clinical changes, ED Triage Reassessment, where triage RNs chart their assessments while the patient waits for a bed, ED Vital Signs, and Intake and Output for Fluids, which are self-explanatory. To view specific information, you can expand or collapse individual areas by clicking the plus or minus buttons beside the categories. To expand or collapse all areas, check the Suppress Blank Rows and Columns under the Options panel, and then click the Expand Collapse Rows button under the tab toolbar. Hover over arrows to view all data contained within cells. Under the Visit Record Review tab is an alternate way of reviewing the data in the tabs that were just reviewed. Under the Navigation section, you can click on the links to jump to specific sections to review. You can expand or collapse categories by clicking on these arrows. Beside categories. To review with ease, it is recommended to view flow sheets under this tab. Documents can be alternatively viewed here . But currently scanned documents cannot be viewed. The Clinical Summary tab pulls information from the current visit all into one summary based on the available tiles as seen here. The ED Visit Summary view is used as a base for a handover document between emergency department and inpatient units or other emergency departments. The information that is displayed includes ED lab results, ED lab vital signs, ED medical imaging results, which you can access the report just by double-clicking on one of the result items, health issues, significant events, ED triage information, ED Clinical Documents, which you can access the document by right-clicking on one of the documents and selecting Show Document Details. Care Providers, and Visit History. The Patient Information View provides patient information such as HSN, admit date, and contact information, next of kin information, and insurance information. This view can be saved as your default view by selecting the Save Display Format button. The EHR Viewer tab is where, if you have an EHR Viewer account, you only need to initially enter your EHR Viewer username in lowercase and password once, and then you can access EHR Viewer with the patient in context. To properly log off at the end of your shift, make sure you click on the red power button and not the X at the top of right corner.
The SCM Viewer Online Manual can be accessed at the following link. SCM questions and issues can be emailed to the following address. IT questions and issues can be directed to the service desk at the following number. You have completed SCM Viewer video training. Thank you.